Thank you very much, and good morning to all of you. Thank you all for coming. I have some really interesting information that I really like to share. We're going to talk about nutrition and pain and how much food that our patients eat affects how badly they hurt. We're going to talk about how the food choices affect inflammation and pain, nutrition rules that complement treatment for pain, and explain how food choices even affect the efficacy of our pain medication. My potential conflict of interest is Speakers Bureau with Standard Process. So as we talk about nutrition and pain, we notice that many chronic illnesses and diseases of many types have similar problems that go on in the body. Gallbladder symptoms, brain fog, aches and pains, peripheral edema, diabetes. And these diseases with commonality and chronicity also are affected by the immune system, affected by what we eat. Crohn's disease, cancer, fibromyalgia, rheumatoid arthritis. We've seen all of these, and the important part is that they're all affected by what we eat. And what we eat has a lot to do with how our body compensates and what diseases and illnesses we get. The common denominator is that we get out of our body what we put into it, whether it's good, whether it's bad, whether it's beneficial, whether it's detrimental. And nutrition underlies disease, nutrition underlies illnesses, and we need to teach our patients how to facilitate their healing process, how to avoid common poisons, how to get the poisons out of their homes, out of their bodies. And when we talk to our patients, we need to speak in a language that they understand. Nutrition underlies every body process, and it's more important than genetic structure. What we eat turns our genes on and turns our genes off. So what you eat is more important than the genes you're born with, because the food will change how those genes are transcribed and how those genes manifest our different processes in our body. So we can eat foods that increase our oxidative stress or decrease oxidative stress. We can increase or decrease chronic inflammation. And we know that the newspapers and the news media have talked about hydrocodone, especially in the United States, and how hydrocodone is maybe one of the highest prescribed drugs in the world, and how the U.S. uses most of the hydrocodone supply. And the correlation could be that maybe our doctors in the U.S. are more free with prescribing medicine. Maybe the United States population is a bunch of drug addicts and just likes to take pain medicine. But there's another answer that I like even better, and that is the food in the United States is really more detrimental than the food in all the other countries in the world, especially in Europe, especially. And so I think that we have more pain in the U.S. and we need more hydrocodone in the U.S. because of the food that our patients eat in the U.S. How much difference does food make? Well, take a look at these pictures. The picture on the left is from February 6, 2013. On the right was February 20th. And all this person did from here to here is change their food, and in 3 weeks it made that much of a difference. Every patient in my office colors a pain diagram on every visit. Yellow is numbness and tingling, blue is pain, red is burning, green is cramping. So this is a man in his 50s, pain since 1988, fell off a 2-story roof, landed on a sand pile on his back. This next one is a woman in her 40s, pain, fatigue, and weakness since 2006. I don't see her till 2013. The picture on the left was January 9th. The picture on the right is February 1st. And this is how much of her pain went away in just a few weeks by changing her food. This is a woman also in her 40s with chronic pain, fibromyalgia, and MS. And between July 7th and August 4th of 2015, she went from this picture on the left to the picture on the right with so much of her pain gone just by changing her food. So the idea of let food be your medicine and medicine be your food has been around for a long time. And so we're going to talk about the rules for nutrition, leaky gut, food is medicine. And there's two aspects to treat when we treat pain. We need to treat the pain that our people have, which involves a lot of their body. And then we also need to talk about how do we get this person healthier. Patients tend to have multiple problems, as I went through in the very first slides. And these problems have common denominators, and we need to do what it takes to get our bodies to heal. So let's talk about the relationship of diet and pain. And there I want to start with a mathematical formula that describes this relationship, wellness and the concept of illness and disease. And so we look at G minus B plus R equals P. No fractions. G stands for the good things you can do to, for, and put into your body. You subtract the number B, which is the bad things you can put into your body. Add this number R, that's the reserve that your body has, which is a number that was given at birth minus what you've used up with time. And those things add up to P, the pain and problems you're going to experience. Well, our patients go to the doctor. Our patients seek us for the P number, the pain and problems. People go to church to negotiate for how much reserve is left in their body. What we can do in our office is change the ratio of the good and bad that people put into their bodies to help them heal and to help them get out of pain. Theoretically, if we have enough reserve left and we change enough of the good and bad ratio, the body can put itself back together. A lot of the diet in this country is like the party of five for the bears. Do you want to wait for a dumpster? So there's 3 rules to nutrition. Rule number 1 is don't put poison into your body. And the poisons that count most for pain are artificial sweeteners and hydrogenated fat. So let's talk, and rule number 2, if you're going to run a race car, use 100-octane fuel. You're not going to go around the track as fast as the big boys if you're eating 0-octane, 30-octane. It's just like a car. If you're going to make your body work better, you need higher quality fuel. And rule number 3 is that inside our belly are billions and billions of critters. Healthy critters and toxic critters. We call them flora, intestinal flora, probiotics, all those kinds of things. And what we need to do is grow the good guys, feed them so that they survive, and then kill the bad ones by not feeding them anymore. And we're going to talk about what that means. So let's talk about rule number 1, the foods to never ingest and where the poisons come from. NutraSweet, Splenda, saccharin, and margarine. Aspartame causes an elevation in serum methanol and serum formaldehyde that has been demonstrated in man and also demonstrated in rat. There's a dose-related increase in hepatocellular carcinoma in rats, and in men, an increased risk of non-Hodgkin's lymphoma, multiple myeloma, and this happens with as little as 1 diet soda per day. It is a multi-potential carcinogenic agent at 20 milligrams per kilogram, which is less than what's considered the acceptable daily intake. Free methanol is created whenever it's heated above 86 degrees. It's a cumulative poison. The EPA recommends no more than 7.8 milligrams per day, and the average diet drink will make 15 to 36 milligrams per can. So it's not a Mickey Mouse dose to just have 1 diet soda a day. It's bad enough you shouldn't ever do it. How is it metabolized? Mostly hepatic. Alcohol dehydrogenase oxidizes methanol to formaldehyde. It's rapidly converted to formic acid. There's a folate-dependent pathway that oxidizes it to carbon dioxide. Ethanol will slow the metabolism and reduce the toxicity. So if you're going to drink a Diet Coke, you should probably put rum in it. The toxicity is from formaldehyde, methanol, and also formic acid. It's been shown to worsen depression in patients with mood disorders. About 10% is converted to methanol. It's neurotoxic, causes brain damage, brain cancer, lowers the seizure threshold, and in many people it causes pain, and it may have to do with the glutamate binding to the NMDA receptor. Splenda, let's talk about that one for a minute. Splenda is made by chlorinating sugar. We put chlorine into swimming pools to kill the bacteria in the pool, and when you put chlorine into your belly, you kill the flora in your gut. So there's been shown a reduction in beneficial fecal microflora, increased fecal pH, and your genetic structure, enhanced expression levels of different genes also changes. So if you're going to be measuring the genes in your patients for which drugs they will do better with or which medications they'll do better with, Splenda alters that genetic expression. And so I've left you the abstract so you don't have to go and look it up. Let's talk about saccharin. Saccharin also alters the gut bacteria and the microbiome, increasing glucose tolerance, increasing incidence of diabetes. It's also not safe to use as a sweetener in diabetics. Let's talk about margarine. Margarine came into our country in the early 1900s. In the late 1800s, Napoleon ran out of butter. In order to fight a war, you need butter, coffee, toast, cigarettes, bullets, butter is a pretty high ingredient on the list. So he held a contest to see who could replace butter, and a scientist bubbled hydrogen gas into vegetable oil and created margarine. In the USA, it became important in World War I, and then later in World War II when the USA ran out of butter, and margarine became part of our food supply. It grew as an industry, and restrictive laws and taxes were eventually repealed. And then it was discovered that insects wouldn't eat it. Mold wouldn't grow on it. It wouldn't support or sustain any life form on this planet. So when we put it into food and fed it to people, that was a really smart idea. Well, how do we relate that to our patients? Well, I talk to my patients about peanut butter. And I say, well, you've got Skippy, Jif, and Peter Pan peanut butter, and where do you keep them? Not in the refrigerator, they're kept in the cupboard. How many things do you keep in the cupboard that don't grow mold? And why doesn't peanut butter grow mold if it's not in the refrigerator? And the answer is because there's poison in it that keeps the mold from growing. And if your food won't grow mold, it also won't grow you. And the poison is hydrogenated oil is in the peanut butter. And if you want peanut butter that doesn't do that, then the peanut butter separates, you have to stir it up, and you have to keep it in the refrigerator. And that peanut butter is much healthier for you to eat. So if your food won't grow mold, it also won't grow you, and you can't afford to put things in your body that your body can't use to build healthy spare parts. And the reason it's in our food is because essential fatty acids decrease shelf life. Hydrogenation improves shelf life. You can leave that margarine outside all summer long. You can leave Cool Whip outside all summer long. Nothing is going to eat it. Nothing will eat the peanut butter either. So what are the effects in our body? Cholesterol levels rise, HDL decreases, LDL increases, prostaglandin balance changes, increased incidence of diabetes, and the most important thing is cell membrane composition. Saturated fatty acids activate skeletal muscles to release inflammatory mediators that trigger macrophages. Pro-inflammatory cytokines induce genes in dorsal root ganglion neurons and increase pain. So this is not incidental. This is a major effect and a major part of why our patients hurt. And as we get to cell membrane composition, cell membranes are made mostly of fat. A lipid bilayer, there's also triglycerides and phospholipids and protein. But the job of the membrane is to bring nutrients in, send waste out, remain flexible and alive. And for neurons, it's to transmit information because those little electric potentials go down the neuron, and that's how we get information. That's how we tell our muscles what to do and so forth and so on. Well, if that membrane isn't normal, none of these functions are going to work well. We're not going to get nutrients in and waste out as well. Our neurons are not going to transmit signals as well. So membrane composition is critical. And the fats we eat are the raw materials that make up these cell membranes in every cell that gets made or repaired that day. So I don't think you want to eat it at all, ever. But there's lots of people that do, and there's lots of people in pain that need to make this food go away. Because the ultimate effect is that when we eat hydrogenated oil, every cell in our body that gets made or repaired that day incorporates this plastic into the cell membrane, and then the cell membranes can't work as well. Plastic membranes don't transmit nutrients, waste, they lose their flexibility, neuronal transmission isn't normal, and with years of eating this, our body becomes like a genuine GM truck that's been fixed by plastic parts. After eliminating hydrogenated oil from the diet, it takes about 4 months to get it out of your red blood cells. We have billions of red blood cells floating around in our body delivering oxygen to poor, tired muscles. Doesn't it make sense that they'll do a better job if those membranes are made out of fish oil than made out of partially hydrogenated stuff? We teach our patients that eating a French fry will increase their pain for 4 months. And it comes down to this biochemical pathway with omega-6 fatty acids and omega-3 fatty acids. And the omega-6s, which we have way too many in our diet, go to pro-inflammatory leukotrienes and prostaglandins, and the omega-3s go to anti-inflammatory prostaglandins and leukotrienes. So that's one of the reasons why we put our patients on fish oil, is to help reduce the inflammatory pain. We talk about nutritional balancing. When we give our patients fish oil, we're displacing arachidonic acid from the membrane and competing with arachidonic acid and changing the balance of eicosanoid synthesis toward anti-inflammatory mediators. There's all kinds of evidence for this. There's evidence in rheumatoid arthritis, there's evidence in heart disease, hypertension, diabetes, dermatitis, significant improvements in depression. Using 1,000 milligrams of EPA and 150 milligrams of DHA was found to be more effective than placebo in reducing depression. There's a study that says also that blood EPA and DHA predict all-cause mortality in patients with stable coronary heart disease, showing that blood levels above the median will reduce cardiac death by 27%. And so I left you that article also. Evening primrose oil is an omega-6, one of the healthiest omega-6 supplements that you can use, and it's effective in rheumatoid arthritis, atopic eczema, and other things. Omega-3 fatty acids, the ideal dose is not known. You might use 1 gram a day for a healthy adult. You might use 5 to 10 grams a day for an adult with autoimmune disease, chronic pain, and neuropsych conditions. Omega-3 fatty acids also can be bought in the drugstore by prescription, and the ethyl ester form is the one that's by prescription. The triglyceride form is the one that's in the health food store. There's a 70% greater absorption using the one from the health food store than using the one that you can write by prescription and get in the drugstore. It is incorporated into RBC membranes faster. And another interesting point I came across is that it does not increase bleeding. Everybody wants you to stop your fish oil before surgery. There's no increased bleeding risk when you undergo cardiac bypass surgery, carotid endarterectomy, or femoral artery catheterization using as much as 3 grams per day with aspirin and clopidogrel. How do you tell your patients what fish oil to buy? Well, if you look on the label will list EPA and DHA in the ingredients, and those are the only words on the label that mean fish. If you buy your fish oil in a discount store that's a very popular chain, you'll find that the EPA and DHA add up to 300 milligrams of the 1,000 milligrams in the pill, and the other 700 is genetically altered soybean oil. So it is a good reason to buy your fish oil from the health food store as opposed from the discount store. So rule number 1 in summary is the fats we eat have a major effect on our body, the health of our cells, the composition of cell membranes, the development of inflammation and pain, and the development of chronic disease. Let's talk about octane. Our patients want to feel like that Ferrari and that happy little bug, and too many of them feel like an old car and a jalopy and a horse-drawn carriage. The lowest octane fuel we can put into our body is white sugar, white flour, potatoes, and fruit juice. A medium-sized potato is equivalent, in essence, to a half cup of sugar. The next lowest is bread, wheat grain. Bread, pasta, whole wheat and multigrain is certainly better than white bread, but we're not designed to run on wheat. Gluten doesn't seem to be universal, but there are some very interesting things that say that none of us should eat gluten either. Soda is one of the most devastating things that we do to our body. There's more than 10 teaspoons of sugar in a can, and the reason that the sugar doesn't precipitate and end at the bottom of the can, like in the experiment we did in grade school where we took warm water, put sugar in, let it cool down, and it all fell down to the bottom. Well, the reason the sugar is not in the bottom of your can is because phosphates are added. And phosphates keep the sugar in solution. And for your body to process phosphates, you bleed calcium. So one of the reasons we are calcium deficient and osteoporotic relates to soda. One soda, I think, is more dangerous than one cigarette. How many people smoke 20 cigarettes a day, pack after pack, day after day? How would you survive if you drank 20 Mountain Dews a day, day after day, and tried to do it 5 days in a row? Some of us would die of maybe our heart would go too fast, we wouldn't have slept in 4 days. All kinds of things point to the idea that maybe pound per pound or 1 for 1, soda is more dangerous than a cigarette. Teenage girls who drink soda have 3 to 5 times more bone fractures than teenage girls who don't, because they don't have enough calcium in their bones to hold them up when they fall. The other effects of sugar include more inflammation, more pain, weight gain, insomnia. If you have a patient that wakes up at 3 o'clock in the morning, it's likely they had a sugar load at 9 o'clock at night that caused an adrenal reaction, an adrenal response that woke them up with a cortisol rush at 3 o'clock in the morning, and then when their alarm went off at 7, they've already used up their morning cortisol and they had nothing to wake up with. It also makes opiates less effective. If you cut down from 6 Mountain Dews a day to 3 Mountain Dews a day, your Percocet is still not going to work well. We talk about how if you've been on this medication for so many years, now you need to have your dose increased because you've just been on it long. I think that's hogwash. I think the reason that the medicine isn't working as well is because the food makes the medicine not work as well. The food seems to touch the same opiate receptor in the brain as the opiates. And so it pushes the opiate off the receptor and makes it not work as well. Your Percocet will work just as well on the 5th year, the 10th year, the 20th year as it did on the first year, as long as the food isn't pushing it off the opiate receptor. So pain has a reason to be worse. If people wake up with pain in the morning that they didn't have the night before, pain does not fall down from the sky. Sometimes it's too much physical activity and we really did hurt ourselves. Sometimes it's increased stress. Sometimes it's poor sleep. But I think most of it is food. If you wake up with pain in the morning you didn't have the night before, it's something you ate for dinner or after dinner that upset your body. If you go to bed with pain you didn't have all day, it's something you ate for lunch or since lunch that's affecting your inflammatory pain. So we teach people to look at their tongue. Why do we have a white tongue? A white tongue, the whiter the tongue is, the more yeast you grow in your belly and the more decompensated your body is from what you feed it. And as you take the foods out that I just mentioned that feed the yeast in your belly, you'll find that the tongue changes. And the white on the tongue dies. These are the same tongue. This is after changing your food, and this is before changing the food. These are the same tongue also. There's no such thing as brown, hairy tongue, even if it's in the literature. It's a white tongue that got stained brown by something somebody ate. And the one in the upper right, I don't have an after picture for that, but the more decompensated the body, the whiter the tongue is, and you should never have to brush your tongue. It should always be pink, no matter what you put on it. So how big is this? Well, I have patients with rheumatoid arthritis, and 1 teaspoon of sugar will make them hurt for a month. The biochemistry of this is that we have increased inflammatory mediators for at least 3 weeks after a dose. Wheat has also changed. Going back to wheat, wheat has been hybridized, genetically engineered, and now the amber waves of grain that used to be 4 feet tall are only 1.5 feet tall. We find that it's got way more gluten than it had 10 years ago. Healthy people get sick, sick people don't get better, and a lot of it is related to what we eat, and wheat has a major part of this. Wheat consumption is linked to visceral fat, inflammatory signals, abnormal cytokines, tumor necrosis factor. All these are generated by belly fat. Belly fat has no business to be on your body. It is an inflammatory organ. This is a thinking organ. These are breathing organs. This is a pumping organ. The belly fat is an inflammatory organ, and all it does is make inflammatory chemicals that injure you every minute of every day. Let's talk about zonulin proteins. Zonulin proteins regulate intestinal permeability. They open the tight junctions between the enterocytes. Zonulins are released by gliadin, a primary component of gluten. And the zonulin proteins are also found in the lungs and the blood-brain barrier. And the idea that wheat increases zonulin proteins and disrupts the integrity of the tight junctions in the gut, in the lungs, and in the brain make me think that none of us should eat gluten. Let's talk about potatoes, also on the list. Potatoes have glycoalkaloids in them that increase intestinal permeability in a similar fashion. It aggravates inflammatory bowel disease, and frying that potato concentrates those glycoalkaloids, and the prevalence of irritable bowel disease is highest in countries where fried potato consumption is highest. So I tell my patients, not a teaspoon of a mashed potato should you eat. You can have all the sweet potatoes you want, but those white, red, and blue potatoes are not something that should be in your diet, and they will increase your pain. Rule number 3 is the rule of critters. The healthy flora in your belly eat green leafy vegetables. The toxic flora eat white flour, white sugar, and hide behind the residues of red meat. When we talk about people who have food cravings. I like to mention where do food cravings come from, and I like to think of it as that we run our body as a democracy. When we choose our food, we think we're voting for what we want, but the critters in our belly outnumber our brain by a lot, and they choose our food too. So you might go through the buffet line and pick all the rabbit food out, and then you get to the cash register and the critters in your belly go, cheesecake, Go back right now and get the cheesecake. And you pull out your calorie counter and go, well, I've got room for cheesecake. That's the wrong idea. Calorie counting is an excuse to eat foods that aren't good for you. That cheesecake should be in that person's diet because it's going to increase their pain, and they need to know about that. So I like to look at food cravings as what is the most important, what is the most efficient form of government, and that's a benevolent dictatorship. So you look at yourself in the mirror every morning and tell yourself that you love you. Not to be narcissistic, but to know that you're worth fixing. And then you decide, as a dictator, who in your body is going to eat today and who is not going to eat today, and stop feeding the ones that shouldn't be fed so that they don't survive, your tongue turns pink, and you get out of pain. Leaky gut and dysbiosis is also part of this. Symbiosis is when the bacteria and flora in our body thrive and help us thrive. Dysbiosis is when they thrive at our expense and take us apart or injure us in the process. Normal, healthy gut flora synthesize vitamins, short-chain fatty acids, degrade metabolic toxins, prevent colonization by pathogens, and stimulate maturation of a normal immune response. Our normal immune response is run by the microbiome in our gut. Dysbiosis is produced by diet conditions that encourage the growth of bad flora, which is mostly soda, sugar, flour, meat. And the toxins from the bad flora injure the intestinal mucosa. The toxins from the bad flora give more work to the immune system, causing fatigue and immune system dysfunction. So how does this all work? Well, the food goes in on the left, and the waste goes out on the right, and the intestine is lined with intestinal mucosal cells. These intestinal mucosal cells have several jobs. One job is absorbing food. We all know that. Another job is that they make IgA. Immunoglobulin A is made by the mucosal cells in the gut, and that's our first-line defense for our immune system. So what happens when these intestinal mucosal cells have been injured and they're not doing their job? Well, the white blood cells out in the suburbs now have to pick up the slack. There's an old quote from Star Trek that illustrates why this contributes to fatigue in our patients, and that is, if you use up the power of your dilithium crystals, you don't have enough juice to run your warp drive. And so if you use up all your energy on your white blood cells, that takes so much energy from your body that it contributes to the fatigue. What else do these intestinal mucosal cells do? Well, they make 95% of the serotonin that's in your body. Serotonin is not made in the brain, it's made in the gut. And that's one of the reasons why gut health is so important for depression and treating depression. These cells also make a barrier. They make a barrier so that poop, poison, and toxic waste doesn't leak out of your colon and into your bloodstream and into your body. And if this barrier is broken, that's what we're talking about when we interrupt the tight junction and we allow the contents to leak, and our immune system now has to compensate for that. This cell injury is caused by NSAIDs, caused by bad flora. It's also caused by radiation. It's caused by alcohol, caused by all those things that injure our gut. And leaky gut syndrome is all about how the intestinal mucosal cells have been injured, permeability barriers have been broken, immune regulation is now severely compromised, and this bacterial and toxic exposure turns our gut into a Superfund toxic waste dump that leaks into our water supply and contaminates our body. You can measure gut permeability with the lactulose mannitol test. Substances that increase this intestinal mucosa, I've already mentioned, NSAIDs, reactive oxygen species, radiation, chemotherapy. And this increased permeability stimulates hypersensitivity responses to food. It increases the pathogenesis of food allergy and the result of food allergy. And in animal models, this chronic low-grade endotoxemia causes autoimmune disease. The history of knowing about leaky gut, or translocation as it's called in medicine, goes back to 1928 when Arnold demonstrated bacterial translocation. And in 1931, it was demonstrated that yeast could translocate through intact intestinal mucosa of normal dogs. In 1961, it was shown that if you drink out of styrofoam, your body will absorb the styrofoam, and you can measure polystyrene in your blood. In 1968, a surgeon named Krauss attempted to convince his colleagues that candida doesn't cross the gut, and so he drank a cup of candida, and within a few hours he became febrile and his blood cultures were positive for candida. So if anybody says that it doesn't work, it really does happen that what's inside leaks to the outside. Diseases that are caused or associated with altered intestinal permeability include inflammatory bowel disease and Crohn's, chronic inflammatory joint disease, irritable bowel syndrome, eczema, acne, and chronic fatigue. So bowel health is of primary importance. Our diet needs to be improved to promote good flora, and we need to restore the integrity of the intestinal lining. And one of the best ways to do that is a supplement called L-glutamine. L-glutamine is the primary fuel for the lining of your upper gut. You can take 4 grams 4 times a day, before meals and before bed. And that is a tremendous help to helping someone restore their gut health. The gut gets replaced every 3 to 5 days, 17 billion cells a day. And you can accelerate that with folic acid. So if you have traveler's diarrhea, 15 milligrams 3 times a day for just a couple of days will so increase how fast your gut replicates itself that that's one of the best things to use for traveler's diarrhea, and you can't overshoot. It can't possibly constipate you. So it's pretty safe. There's other nutrients that will reduce translocation. They include arginine, glutamine, omega-3 fats, and insoluble fibers like lignin. Symptoms associated with bowel permeability not only are abdominal pain and distension, diarrhea and fatigue, but arthralgias, myalgias, cognitive memory deficits, and the feeling of being toxic. L-glutamine deficiency is associated with villus atrophy and degeneration. There's a study in 1957 in the Texas Medical Journal showing that peptic ulcers will heal in 4 weeks using 1.6 grams per day. If you do use L-glutamine in your patients, the only people that I've ever seen get in trouble with it are fragile diabetics. It does affect the sugar load if you're a fragile diabetic, but if you're not diabetic, you can use this pretty much with impunity. Proton pump inhibitors are one of the more dangerous things that we put our patients on, and when our patients get put on them, they don't ever seem to come off. It's a drug that you just seem to use, and the only people that really can't get off the proton pump inhibitors are the people with Barrett's esophagus. That seems to be a little bit different and more difficult to treat. But what are the consequences of these proton pump inhibitors, and why are they dangerous? Well, if you don't have acid in your gut, you don't absorb as many minerals, so you become magnesium deficient, calcium deficient, you get more muscle spasm, you get more osteopenia, you don't absorb vitamin B12, so your energy systems don't work, and you don't digest protein and absorb protein as well, so you become partly malnourished from that also. So if you're getting that, then you know that proton pump inhibitors are not compatible with long, healthy life. So how do we get our patients off them? Well, I start my patients on the L-glutamine, 500 milligrams, or 4 grams actually, 4 times a day, best before meals and at bedtime, and an extra dose every time they have indigestion. And after 2 to 4 weeks of this, when their gut seems to be stable, they start to miss 1 dose every 3 days of their PPI, and then stabilize their gut again, and then miss 1 every other day, and then miss 2 days out of 3. And some patients can usually get off their PPIs anywhere between 4 weeks and 3 months using this kind of a protocol. So bowel health is very important. We want to remove and eliminate the parasites and undesirable bacteria, discontinue eating the foods that cause pain, replace digestive factors that the body might not be making enough of, and then re-inoculate and take probiotics to put healthy flora back into your gut and provide the nutrients for cellular repair. No talk on nutrition would be complete without at least mentioning water. Water is 3/4 of our body mass. Daily requirement is 1 quart per 50 pounds of body weight per day is what we should drink in water. There's 700 synthetic organics found in drinking water, and less than 10% of them are tested for safety. There's a positive association between chlorination byproducts and bladder and rectal cancer. Skin absorption. If you're going to filter your water, your drinking water, you should also pay attention to filtering your shower water, because you'll breathe the steam of chlorine, and the chlorine in the water will also go through your skin. Skin absorption of contaminants contributes anywhere between 30 and 90% of your total daily dose. And the respiratory exposure, as I mentioned, is also important. So how does this all add up? G minus B plus R equals P. When years are spent trying to run our high-performance biochemical Ferrari on bad oil and low-octane fuel, we wear out reserve more quickly, and we develop pain and problems and illness more quickly. What is fibromyalgia? Fibromyalgia is not a disease, it's a condition. It's a picture of a person that has multiple systems that aren't working well. None of them bad enough necessarily to get their own specialist and their own doctor, but all of them bad enough to be causing symptoms. It's a name that means this body has fallen apart. And the reason it looks different in everybody is because everybody falls apart differently. We're all put together differently. We all fall apart. Different organ systems in this person or this other person will all decompensate at different rates, and it all looks slightly different in every person. I've overheard fibromyalgia sufferers talking and saying, I gave up my life because of this disease. I'm not going to give up my food. And perhaps it's because of the food that their life has become what it is. Some people think it's too much hassle to eat right, and maybe it is a lot of hassle to eat right. But I also like to suggest that ulcer disease, diabetes, heart disease, cancer, fatigue, fibromyalgia, and pain are way more hassle than eating right. What's in an apple? You can't measure what's in an apple and put it into a vitamin. What's in broccoli? You can't measure what's in broccoli and put it into a vitamin. The food is so important. Vitamins are helpful too, but you got to start with the basics of what's in your food. Thank you very much.